We'll start with the thyroid. So remember how the anterior pituitary releases this thyroid stimulating hormone? Well, he's going to tell the thyroid to release his own set of hormones. The thyroid gland is located right here in your throat. He actually kind of wraps around on the larynx. Larynx is obviously a little tube. We talked about larynx in AP1. It's a little tube that connects the oral cavity and the nasal cavity to the trachea, right? So it allows for passage of air. Trachea looks like this. It's a series of circular or semicircular cartilages that connect together. It's like 3 to 5, I don't know what is that? It's like 5 to 9 centimeters long or something like that. And it's about this long. That's what the trachea looks like. The largest cartilage, it's your Adam's apple. It's the thyroid cartilage because he's right inside the thyroid. The thyroid gland itself, if this is the anterior view of the trachea, you know, and then obviously you got like your, anterior view of the larynx, you got your trachea down here. What we'll see is that the thyroid is a patch of tissue that hangs out on either side and kind of wraps around the front like that. So this is your thyroid. Now the thyroid gland, when he receives the signal from the thyroid stimulating hormone, is going to release thyroid hormone, okay? What does that thyroid hormone do? Really, what's the purpose of the thyroid? Exactly, so this gland, I mean, his big role is metabolism, to control metabolism. So the release of thyroid hormone, there's a couple, but we don't have to worry about the specific names of it. It increases how quickly your cells consume energy, undergo cellular respiration. It increases the amount of cell division. It just increases the rate of chemical reactions in your body across the board. That's cellular metabolism. Metabolism is just the rate of chemical reactions in your body. It's going to increase that rate. It's going to increase body temperature, right? So it has a huge role in maintaining that 98.6 degree normal body temperature. A hypersecretion of thyroid hormone, it can lead to conditions like Graves' disease. Graves' disease, a common symptom or characteristic is you'll have someone with like the sunken in, bulging eyes, very, very thin. They can't keep on weight because their metabolic rate is so high that they're consuming more energy than they should be just in a resting state. It leads to nervousness, irritability, anxiety, because it also functions as like a stimulant for the whole nervous system, you know? And it's gonna relate to fever, you know? So people with that condition are gonna have like an elevated body temperature. Hypothyroidism, what do you think the symptoms of that would be? Weight gain, right? Chills, lack of energy, low body temperature, you know? So this is all about the regulation of how quickly the cells do their activities in the body. These dysfunctions, you know, so hyperthyroidism or hypothyroidism can be caused by tumors of the thyroid. I had a girl in one of my classes, I think 2 years ago. During the class, she came to office hours and she's like, she had been diagnosed with a malignant tumor in her thyroid that afternoon. And she was young, she was like 22 years old. And she was like, yeah, I just felt this lump in my throat. And I went to the doctor and they did a scan. It turns out it's a malignant tumor and they want to operate ASAP. And I was like, you know, oh my gosh, it's horrible. She's like, yeah, but I'm gonna put it off because I want to finish all these classes. I'm like, no, you gotta get that taken care of, right? This is very sad, but the prognosis for recovery from thyroid cancer is actually very high, and it's because of this. So the thyroid hormones depend on iodine, so they require iodine as a component for this hormone to function. So the thyroid gland takes iodine that's in our body from our diet, and it synthesizes these thyroid hormones with the iodine. If there's not enough iodine in the body, okay, then these hormones can't be completed. Well, in the case of this student, what the treatment